So our speaker, Elena Marques. Dr. Elena?
Yeah.
Can you hear us? Yeah?
Yeah, I can hear you. Shall I start?
Yeah, hi, Elena. I would just like to introduce you to our audience here. Dr. Elena is a professor at Contrado Doctor. She's an associate professor of physiotherapy, the Department of Physiotherapy in the University of Valencia, that is Spain. She's a board member and counselor for allied professionals, ESC Association of Cardiovascular Nursing and Allied Professions. She's also a nucleus member of the Secondary Prevention and Rehabilitation section. She's into the research committee at the ESC, which is European Association of Preventive Cardiology, EAPAC. She's also the scientific committee on comorbidity study group on frailty. She's the Congress Program Committee, which is in, again, ESC, ACNAP. She's the research mentor at the ESC Association of Cardiovascular Nursing and Allied Professions. And the list just goes on, but a few more. She's a board member of the Heart Institute of Valencia. Also a special programming, she's also part of the special programming committee in the International Association of Research on Service Learning and Community Engagement. And it just goes on, but I would just like to end with the last one, which is she's also a part of the Gathering Committee, International Association for Research on Service Learning and Community Engagement. Over to you, Dr. Elena.
I'm not sure if you can see my screen.
Yeah, we can see your slides, and also we have you on the visual.
Okay, perfect. Yeah. Okay, so firstly, I would like to thank to the organizing committee for inviting me to this interesting Congress. And today I'm going to present the following research titled Effects of a Combined Program Based in Interval Training in Patients with Coronary Artery Disease. I have nothing to declare. And firstly, I'd like to talk about cardiac rehabilitation in general, which, as we all know as physiotherapists, is recommended in patients with heart disease, and especially in patients with coronary artery disease. Several associations and societies, such as the European Society of Cardiology, the American Heart Association, and some others, recommend to perform cardiac rehabilitation. And after a cardiac event, cardiac rehabilitation is a class 1 recommendation by the European Society of Cardiology. And this society, which is our society of reference here in Europe and in addition in Spain, has published several guidelines, as you may know, like those ones published in 2012, also in 2016, and the latest one in 2021. Then lifestyle changes in coronary artery disease are also important things to be performed, and healthy behaviors are associated with decreased risk of future cardiovascular events and death. And then lifestyle changes that include regular exercise and a heart-healthy diet are recommended in the rehabilitation or physiotherapy of patients with this disease. We should talk about the multidisciplinarity of cardiac rehabilitation programs. This means that there are several professionals, healthcare professionals, that are involved in these programs, which are, as I said, multidisciplinary. For instance, the cardiologist, the physiotherapist, of course, nurses, psychologists, dietitians, and it's very important to take this point into account. The multidisciplinary cardiac rehabilitation programs decrease cardiovascular mortality and hospitalizations when compared with no exercise, and increase the referral rate and participation of this type of patients. Then, as we said before, both regular exercise and a heart-healthy diet are important outcomes or important things to take into account in these multidisciplinary programs. but it's not also about physiotherapy and diet. There are also some issues that should be taken into account, such as smoking, of course, physical activity, diet, healthy parameters like weight, anxiety, depression, also pollution, and multidisciplinary treatment is always important. Now we're going to talk about physical activity. These recommendations are 30 to 60 minutes a day of moderate intensity aerobic activity, physical activity, and at least 5 days a week. Even irregular leisure time physical activity decreases mortality risk in previously sedentary patients. And the increase of physical activity is related to a decrease in cardiovascular mortality. And particularly resistance exercises help to maintain muscle mass, strength, and function, and also benefit other outcomes such as insulin sensitivity, control of lipids, and blood pressure. When we physiotherapists prescribe exercise, we usually focus on several parameters such as frequency, intensity, time, and type of treatment, type of exercise. So regarding type of exercise, we usually distinguish about continuous training and interval training. And when we talk about intensity, we usually, as we said, perform programs based in moderate intensity interval training. But anyway, high intensity interval training has been proven also as a useful alternative and has also been recommended by several societies. A heart healthy diet should include diet high in calories, salt, sugars, saturated fats, trans fats, and poor in fruits, vegetables, and fish is the greatest risk factor for the development of coronary artery disease. And in this sense, Mediterranean diet should be implemented in patients with coronary artery disease. Regarding weight management, the risk of cardiovascular morbidity and mortality has been found to be higher in patients with overweight or obese patients when compared to those who have a healthy body mass index. In this regard, obesity is related to a shorter overall lifespan, and overweight is related to developing cardiovascular disease at an earlier age. When we're talking about waist circumference, we should consider that it's a marker of central obesity, and of course it's associated with cardiovascular disease and specifically associated with diabetes. And this waist circumference should be lower than 94 centimeters for men, lower than 90 centimeters for South Asian and Asian men, and lower than 80 centimeters for women. In those with coronary artery disease, intentional weight loss has been found to be a lower risk of adverse clinical outcomes. Here we have several lifestyle changes which are important, such as smoking cessation, healthy diet, physical activity, healthy weight, and others. And as we said before, we are going to focus on healthy diet. For instance, healthy diet high in vegetables, fruit, whole grains, limit saturated fat to lower than 10% of total, and of course limit alcohol. And physical activity, as we said before, 30 to 60 minutes of moderate physical activity, but even irregular physical activity is beneficial. Now we're going to talk about the aim of the study, which was to compare the effectiveness of dietary education and high-intensity interval training compared to high-intensity interval training only on anthropometric parameters and healthy food choices in patients with coronary artery disease. This study was performed in a rehabilitation clinic in Valencia, Spain, and it was an assessor-blinded randomized controlled trial with 2 arms or 2 groups. The first group was a group which performed a dietary education program plus high-intensity interval training, and the second group performed only high-intensity interval training. And both groups were composed of 22 patients with coronary artery disease. Both interventions were delivered by a physiotherapist and a dietitian, and the program lasted 3 months. Now we're going to talk a bit about high-intensity interval training. We perform a program, as we said, of 3 months of duration. It was performed 2 days a week, 2 sessions a week, 1 hour each session. And it was composed of 3 parts. First one, a warm-up of 10 minutes of duration, followed by an exercise part of 30 minutes of duration, and we finished each session with a cool down of 10 minutes. The warm-up part included light walking and several flexibility exercises such as isotonic hip and knee flex extension, and also shoulder flex extension and elbow flex extension. And we finished with self-stretches, 6 self-stretches of both lower and upper limbs. Regarding the exercise part, we performed 1 minute lower and upper limb exercises at an intensity of 85 to 90% of peak heart rate. These exercises were hip flex extension and knee flex extension, hip abduction, shoulder flex extension, elbow flex extension, and shoulder abduction. And each minute was followed by a 1 minute of active recovery break, which included 0.5 kilograms of dumbbell exercises, shoulder flex extension, elbow flex extension, and we finished with walking. And the cool down was the same as the warm-up. We performed light walking and same flexibility exercises and self-stretches that we said before. The dietary education workshop were held 1 per month with a duration of 2 hours each sessions. We performed 3 workshops delivered by a dietitian. Workshops included a participative oral presentation and worksheets to encourage active participation. And additionally, each workshop was followed by a question and answer session. And after every workshop finished, each participant was given a dossier summarizing the information and the chance to solve any questions by contacting the dietitian. And the topics covered were as follows. We have 3 main topics. The first one, healthy eating and food myths, including basic concepts about healthy eating concepts, characteristics and benefits of healthy eating, relationships between coronary artery disease and healthy diet, nutrients in a healthy diet, and other components of the diet, and finally, food myths. The second topic, how to organize your daily diet, where we applied all the theoretical concepts learned and how to implement healthy eating in daily life, from weekly organization to the shopping list, reviewing nutrients and their importance in the diet, organizing the pantry, healthy food at home, learning how to draw up a weekly menu, stylishing dishes, and drawing up the shopping list. And then the third topic, how to interpret nutrition labeling, the importance of labeling, regulations, part of a labeling workshop, putting into practice what they have learned using real product labels in order to choose the healthiest products. Then we measure the following outcomes or variables. First, anthropometric parameters such as body composition, including body mass index, body fat, visceral fat, or muscle mass. Also, body circumferences, waist circumference, hip, calf, arm circumferences, and also relaxed circumferences. And finally, waist-hip index. And also tricep skin fold thickness. Apart from the anthropometric parameters, we also measure the change in diet, including the adherence to the Mediterranean diet questionnaire and the food consumption frequency questionnaire. This table shows the characteristics of the participants. As we can see in the table, most of the participants were men, married, with primary or secondary education, presented dyslipidemia, and obesity. This table indicates timeline where 1 is the baseline and 2 is 3 months. Here. Indicates timeline mean scores and standard error for the anthropometric measures found significant. As we can see in the table, a significant interaction between group and time was found for the DHEAT group for body mass index with P lower than 0.001, waist circumference with P lower than 0.001, waist hip index with P equal to 0.003, also with forearm circumference with P lower than 0.001, and finally for calf circumference with P equal to 0.003. And also the DHEAT group showed also a significant improvement in body mass index, waist circumference, waist hip index, arm circumference, and calf circumference. When investigating the main effects of group and time, we found a significant difference in the MEDAS-14 score, which is the adherence to the Mediterranean diet, between the two groups, with P equal to 0.011 and the 2 time points. Regarding the food consumption frequency questionnaire data, over time, compared to the high-intensity interval training only group, the group which performed dietary education and high-intensity interval training consumed a greater quantity of vegetables with P equal to 0.008 and a smaller quantity of bottled juices with 0.040. So in conclusion, a combined high-intensity interval training program and a dietary intervention can help to achieve the desired health outcomes in patients with coronary artery disease, such as anthropometric parameters and healthy food choices. Thank you very much.
Thank you so much. It was a very, very insightful session. And we are very thankful for this great session. Yes. Do we have any questions from the audience? No? Good. So I think it was insightful enough for everybody to understand it well. Thank you so much, Elena.